Dan is 64 and comes from Poland, but has been living in England for many years. In spite of this, his English is not very good. When he goes to see his GP about a recurring problem with his knee, he takes his wife Rosa with him to help. Having looked at the problem knee, Dr. Carson decides an X-ray is required. She types knee X-ray into the NHS e-Referral service and is then prompted to fill in Dan's clinical information on an X-ray request template to be sure that he is suitable to have the test done. She then quickly and easily submits the completed template. Having completed this, the NHS e-Referral service displays a list of possible NHS and independent hospitals where Dan could go for his X-ray, so she asks Dan and Rosa if they have any preferences. They do not mind which hospital, but would like the soonest appointment, wherever it is. Dr. Carson indicates that there is an appointment showing at a local hospital for the next day, and asks them if they would be able to make that one. They agree, and the doctor books the appointment and selects to have the X-ray report sent back to her via the NHS e-Referral service. Dan requests a paper copy of the appointment details, which the doctor provides. Dan has his knee X-rayed the following day, and as soon as the report has been completed, Dr. Carson sees it has arrived on her work list at the practice. When she checks the report, she sees that it indicates that Dan has moderate osteoarthritis in his knee. Dr. Carson types osteoarthritis into the NHS e-Referral service. The system alerts her that the locally agreed pathway is for all such referrals to be sent initially via a referral assessment service. Dr. Carson therefore simply attaches all the relevant clinical information from Dan's record, including his recent X-ray report, and a note to say that his wife will act as his interpreter. Using the NHS e-Referral service, Mr. Flynn, a local orthopaedic surgeon, reviews Dan's referral. He reads the clinical history and reviews the X-ray report and decides that the patient really should be seen by an orthopaedic consultant. He then creates a list of all the appropriate services and passes this on to his secretary so that she can contact Dan. Nicola, Mr. Flynn's secretary, speaks to Rosa, the patient's wife, on the telephone and explains that Dan needs to see an orthopaedic consultant. She tells Rosa about the services which have been identified as appropriate and asks if Dan is happy to select one from this list. Rosa asks for an appointment after they return from holidays in 2 weeks' time. Nicola browses through the available dates and advises Rosa of suitable appointments in 2 weeks' time at a local hospital, and they agree on a date. Nicola books the appointment and asks Rosa how Dan would like to receive the confirmation. Rosa asks for this to be emailed to Dan, as they have a program on their computer that translates English into Polish. Nicola confirms Dan's email address and emails the appointment confirmation. Rosa also asks whether a Polish interpreter can be booked for the consultation, as some of the medical terminology is difficult for her to understand. Nicola advises she is able to do this using the NHS e-Referral service. Nicola books a Polish interpreter for the same time as the appointment. The vision for an NHS e-Referral service is to enable support and choice along the whole pathway, a service that is easier for patients to interact with, reduction of inappropriate referrals, clinicians aware of patients' progress through the pathway, overall improved pathway management for both clinicians and patients. Find out more by contacting us via our mailbox or take a look at our website.